Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Radiation exposure. So under radiation exposure, what is the source of exposure and the radiation dose? So first is we look at the dental X-ray. So under the dental X-ray, the radiation dose will be 0.00, 0.005 and this is nothing but the MSV. Next, moving on to the chest X-ray. So chest X-ray will again be 0.02. So 0.02, this is the MSV. And looking at the CT scan of the head. The CT head is going to include the 2 to 3 ms. Then moving on to the CT scan of the chest. The chest is going to be 8 MSV. So the head is 2 to 3, the chest is 8 and then the whole body scan. So we have something known as a whole body scan. So whole body scan is including 10. It will be 10 MSV is a whole body scan. Now looking at the abdomen and pelvis CT. So abdomen and the pelvis CT. So abdomen and the pelvis CT, this includes the 8 to 11. So there is 8 to 11 MSV. This is the abdomen as well as the abdomen and pelvis will include the 8 to 11 MSV. Now PET CT. So PET CT it includes about 5 to 15 MSV, 5 to 15 MSV, and looking at the SPECT. The SPECT includes about 2 to 5 MSV, 2 to 5 MSV. Now the CT scan of the abdomen and the pelvis has a radiation dose equivalent to approximately about 500 chest X-rays. So a CT scan of the abdomen and pelvis has a radiation dose equivalent to 500 chest X-rays. Then moving on to the radiation. The radiation exposure. So in case of radiation exposure, in case of a CT scan, radiation exposure in case of a CT scan is greater than that of the bone scan and it is greater than that of the X-ray. This is from the maximum to the minimum. To learn and grow daily like this, please do subscribe.